with more and more people vaccinating, I thought, it's important to give you the do's and don'ts before and after vaccinations. Let's discuss with a better mind, Professor Helen Rees. Professor Rees is a member of the Ministerial Advisory Committee and the MAC Vaccine Committee advising the Minister of Health on COVID-19, as well as the chair of the South African Health Products Regulatory Authority Board, among the many other hats she wears. Professor, always a pleasure having you on the program. Welcome to the agenda.
Thank you for having me.
All right, let's get into the do's and don'ts, what's on the minds of many sitting and watching us. Something that seems to be in the minds of many with regards to before and after vaccination is alcohol. Will alcohol mess with the efficacy of any of the vaccines, the J&J and Pfizer? Your thoughts on that?
No, it won't. I think that there might be some confusion because in the lockdowns, we stopped the sales of alcohol with the level 4 lockdowns and the original lockdown. But the reason that we did that wasn't anything to do with vaccines. That was because we wanted to conserve hospital beds. We wanted to stop some of the trauma that goes on over weekends and so on, and people drinking, because we recognized the hospitals were going to get overwhelmed with COVID cases. But in terms of vaccination, no, alcohol before, alcohol afterwards, it won't have any impact.
All right. So I vaccinated a couple of days ago, and I wasn't told what I need to stay away from. But when my wife went the next day, she was told to stay away from aspirin, stay away from immune boosters for 7 days, etc. I worry about the lack of consistency with regards to briefing people who get vaccinated, but that's another story. But what about those that advise? Stay away from aspirin, stay away from immune boosters after you vaccinate, correct?
Well, there isn't actually any evidence for that. Vaccines are very, very potent, so they're going to stimulate your immune system. But in terms of aspirin, it's an anti-inflammatory, and certainly for the treatment of COVID, we're recommending rather to use paracetamol rather than aspirin in the first instance. So there again might be a bit of a confusion. But in terms of just advice for people who are going to get vaccinated, and by the way, congratulations for having your vaccine, and I really support everything that was said on the little insert before from the Western Cape. Everybody, please line up and get your vaccines. And if you're nervous, go and talk to people. I know a lot of people are nervous. Go and speak to the nurses. You don't have to have the vaccine on day one. Go and get more information. But please have the vaccine. So, yeah. But in terms of some of the things that we would ask people about, first of all, if you've got symptoms of COVID infection, we don't want to vaccinate you when you're actually infected with COVID. And sometimes common coughs and colds will give you similar symptoms. So it would be important that if you do have any of those symptoms, running nose, headache, sore throat, coughing, any of those sorts of symptoms at all, that you let the healthcare provider know. And if you need to have a COVID test, they'll advise you. But we don't recommend that. The second thing is, if you've ever had a bad allergic reaction to another vaccine, so it's very rare, it's not common at all, but some people do react to some of the ingredients of a vaccine. And if that's the case, please let the healthcare provider know, because then we would be more cautious about monitoring you after you've had the vaccine. Just in case one of the ingredients in a previous vaccine is also in one of the vaccines that you're receiving now.
All right. So when you are COVID positive, when is it safe in terms of the duration after to get a vaccine?
Well, it's probably safe quite soon after, but we're being very cautious about this. And it's more about people's symptoms. Because if you've had COVID infection, you've had a huge stimulus caused by the virus on your immune system. And if we then come along with a vaccine and we reboot your immune system, you're much more likely to get some of these side effects and probably a bit more severely. So we're being cautious, and the recommendation in South Africa at the moment for our national program is wait for 30 days. So wait for 4 weeks before you have the jab, after you've had the infection.
All right. So what what's the data telling us about natural immunity? What sort of level of protection does it offer you once you become infected, and how good is it against Delta?
Yes, and this is where it starts to become more and more complicated, because, as you know, we have what we call the ancestral strain. That's the first virus that affected the world. And then, as you know, we moved in South Africa to the Beta and now to the Delta variant. And there's a few of other variants, the Alpha variant, but the really big ones we've had is the Beta variant and the Delta variant. Unfortunately, from the original infections, the ancestral strain, the first virus that we had, it would appear that the sort of immune protection that you get against now the Delta variant isn't very robust. The other thing, of course, is we don't know how long that protection will last. And many people who got infected early on in the pandemic, we don't know how long and how robust that protection from the original infection would be anyway. But we certainly know that the antibodies that you got from some of the earlier variants are not going to be as protective against the Delta variant now, which is why we're seeing reinfections. But it's not an absolute. And so, I think that if you've had an infection, one of the reasons we're saying to everybody is please still get a vaccine, because we can't say whether or not your natural immune response is going to protect you. We want you to also have a vaccine.
All right. Reportedly, Prof, there's a US CDC report saying that the Delta variant is more transmissible than the common cold. That headline jumped out at me. What more are we learning about this?
Yes, and I think, from the time that the Delta variant first emerged in India, we saw how it swept through India. And of course, they have a very large population. But even then, we people were really struck by how it seemed to be just sweeping through families. And then we've had the same experience here now with our third wave, that we're seeing these patterns of whole families getting infected very quickly, which we didn't really see before. And I think everyone is starting to say we seem to be seeing more people that we know with infection, more people dying that we know. So certainly the Delta variant is behaving in a way that the other variants have not. And in terms of transmissibility, that is correct. I think that we've now really recognizing that it's much easier to transmit the Delta variant than the earlier variants. And you mentioned, is it more than the common cold? So interestingly, viruses have different rates of transmissibility. One of the most easily transmitted viruses, for example, is measles. Very easy to transmit. And you have to have a lot of people in your community who are protected with vaccines against measles if you're not going to have outbreaks. Ebola is not so easy to transmit, interestingly. It's a nasty disease, but it's not that easy to transmit. So we're looking all the time at the characteristics of these different variants of COVID as they emerge. And transmissibility is one of them. And definitely the Delta variant does seem to be more transmissible than the earlier variants that we've seen.
Right. Vaccines mitigates or reduces your ability to communicate the virus to others. True or false?
Another good question. And one of the things that people must also understand is the vaccines that we've got now, remember, we developed them against that original virus. So every time we have a new variant, we have to ask the question, are these vaccines going to work as well against the new variant? And we have to ask it for every single vaccine. Now, fortunately, the vaccines that we've got at the moment, the Pfizer and the J&J, both seem to be effective against the Delta variant, but particularly against severe disease and hospitalization. And in fact, if we look at most of the vaccines that are in advanced stages of development and are being rolled out around the world, a lot of them seem to still give protection against severe disease and hospitalization, but much less protection against mild and moderate disease, and less protection against actually getting the infection at all. So the good news is all the vaccines seem to give a level of protection against severe disease, much less in terms of mild and moderate disease. And in terms of do they stop transmission? Well, this is something that we also have to try and understand. It would appear from some of the epidemiology, the studies that have been done in many countries, that the vaccines do have an impact on reducing transmission. but it's not absolute. And that's why we say to everyone, even if you've had a vaccine, that we want you to continue wearing masks in high-risk situations. Yeah. So it means that having a vaccine, you still have to wear a mask, because number one, the vaccines are not 100% effective. None of the vaccines are 100% effective at protecting you. And number two, we don't know about transmission. So please continue to wear those masks.
I think that's a very important point, because some people tend to think that this is, a cure. It's not. The understanding is that vaccines blunt the severity of illness, so it's likely to keep you out of the hospital. It's likely to keep you out of the morgue. You can get sick, but you won't get very sick. That's the hope and that's the aim, and that's what's the science telling us. Correct, Prof?
That's quite correct. And if you look at in the US now, they've also got a huge surge of Delta variant. And what they're seeing is the people who are being hospitalized are the people who have not received vaccines. A lot of citizens in the US haven't received vaccines, despite them being available. And they are really seeing the deaths and the hospitalizations amongst the unvaccinated. So vaccines, certainly, you said it very nicely, it blunts that severe disease. You're completely correct. That's what we want to do at the moment.
What about pregnant women, Professor? I know there was a cautious approach initially with regards to vaccines. Can pregnant women get vaccinated?
Yes, they can. The data on pregnant women has been accumulating because, of course, in the early clinical trials, there were tens of thousands of people who enrolled. And although pregnant women were excluded, inevitably some women didn't know they were pregnant when they enrolled in the studies, or they became pregnant after they'd had the vaccine. So we were able to get some data about the safety of these vaccines in pregnant women from those early clinical trials. And now increasingly, as we're rolling out to millions and millions of people around the world, people are monitoring the safety of the vaccines in pregnant women. And so far, the safety looks good in pregnant women. It looks good in terms of the woman's health, and obviously very important. All women would be very concerned about this, the health of the unborn child. So these look good. What we also know, and this is really important, is that pregnant women seem to have a higher risk around hospitalization, particularly intensive care, and also if they get COVID, they also have a higher risk of preterm birth. So their risk from COVID infection is significant. It's more than a non-pregnant woman in terms of intensive care and preterm birth. And so for that reason, now we've got safety data. We are saying to pregnant women, go and talk to your provider, make sure you're comfortable. But at the moment, we think that it's wise if you're pregnant to consider having the vaccine, and particularly if you're a working pregnant woman and you're out and you've got a potential for you're a healthcare worker, you're working in a shop, and you're meeting a lot of people, you are at risk of getting the virus. Then really you should be thinking about having the vaccine. But we're monitoring the safety all the time.
Right. Prof, you mentioned what's happening in the United States and vaccine hesitancy or resistance. It almost seems in parts of the United States that it's a show of strength if you don't wear a mask and you don't vaccinate. Politics creep in. But what's your level of concern here in South Africa? Is vaccine hesitancy stalling pandemic recovery?
Well, I think at the moment, overall, no, but I think that there are a lot of people who are nervous and are delaying. And I think if you look at the over 60s, we haven't reached nearly as many of the over 60s as we should, and they remain one of the most vulnerable groups in terms of what happens if they get COVID infection, in terms of both death and hospitalization. And people are nervous. They're not familiar with having a vaccine. Some people might not even recall in their lifetime having had a vaccine. And it's not always easy for people who are older to just access a vaccine site. So one of the things that we're really trying to encourage families to do is to say, if you've got an older relative, and now that you as a younger person are now also being offered the vaccine, try and give them the confidence. And if you can, give them a lift. And if you can, just really encourage them to get somewhere so they can also have the vaccine. But I think that in terms of the vaccine hesitancy worldwide, I mean, we worried for many years about, the anti-vax movement. Because, we want, for example, we want children to be immunized. We save millions of children's lives in the African region every year by giving childhood immunization. So we don't want this kind of message that vaccines are, there's some sort of conspiracy that people are going to be able to monitor you and watch what you're doing. This is all rubbish. What we want to do is save lives. But the anti-vax movement is small in terms of COVID. What is much more common is that people are saying, is it safe? Will I get side effects? Will it really protect me? That nervousness is the one that we really have to contest at this time. And I'm really hoping now we're opening up to young people who are enthusiastic. The number of young people who are saying to me, in shops and things, I want the vaccine. When am I going to get it? If we can get a wave of really positive response, I think it'll help those who are feeling nervous sort of say, okay, let me also take the plunge.
And what about this monetary incentive to get vaccinated? I've seen it happening in the United States. The ethics, though, around this. Are you comfortable with the country going down that route?
Well, I don't. We're not as rich as the United States. I think you've heard all sorts of incentives. I think, including lotteries where people winning $1 million. If you got the vaccine and you were lucky enough to be pulled out. So South Africa is certainly not in that kind of financial situation. But I think trying to incentivize is going to be important. And I mean, one of the discussions we're going to have as a country is about the workplace. It came up last week with COSATU having some concerns, but saying that COSATU also wanted, and the trade unions also want to encourage people to have vaccines, but they're concerned about compulsory vaccination. But it is a discussion we'll have to have. Because, for example, if you work in a home with frail or elderly people and you're a healthcare worker, what is your responsibility about having a vaccine? So that is something that we're still going to have to think about. But I think we first prize, encourage, build confidence. We want people to want the vaccine. That's the route that we should be going at the moment.
You have a right not to get vaccinated, but is it the right thing to do? I think people should be able to weigh the risks and benefits for themselves. We will do our part to bring in the better minds like Professor Rees to give you the facts. And we thank you, Prof, for your time and your insight. Be well.
Thank you so much.